In this video, I'll be discussing the Retroviridae, specifically the retroviruses affecting domestic animals. So in cats, this is feline immunodeficiency virus and feline leukemia virus. In cattle, bovine leukemia virus. In sheep, Jagdziekte sheep retrovirus and Visny-Maedy virus. And the related virus in goats, which is caprine arthritis encephalitis virus. In horses, we have equine infectious anemia virus. The well-known retrovirus in humans is human immunodeficiency virus, or HIV. So just a quick recap on retroviruses. They are RNA viruses that uses a reverse transcriptase enzyme to convert themselves from single-stranded RNA into double-stranded DNA, which then inserts itself into the host DNA. That means that once infected, an animal or person is infected for life. In fact, about 8% of the human genome is made up of retroviral sequences. So on to the first virus, feline immunodeficiency virus. So this virus is recognized by different stages of infection. There can be a long incubation period before an acute phase. This is followed by an asymptomatic phase, which can last months or year, before a chronic terminal phase. So with this virus, there's not a true latency, as there is continuous low-level expression of viral proteins. What occurs with this virus is that there's a gradual destruction of CD4 helper lymphocytes, resulting in a loss of immune function. The only route of natural transmission that has been proven is through biting, as the virus is unable to survive for very long in the environment. That means that there's a much higher prevalence of the disease in cats that fight a lot, specifically territorial males that are uncastrated and are free roaming. The disease has also been reported in wild felids such as lions and cheetah. FIV targets white blood cells, specifically CD4 positive lymphocytes, and like HIV results in an inversion of the CD4-CD8 ratio, resulting in a gradual destruction of the immune system. There may be a long period where an animal is asymptomatic and the virus is difficult to detect in the bloodstream. Antibodies are produced to these viral proteins, but they are insufficient to clear the virus. The continuous presence of antibodies forms the basis for detection assays for FIV. So this graphic summarizes the pathogenesis of FIV, showing a continuous low-level expression of the virus and progressive immune dysfunction. The failing immune system allows opportunistic infections to take hold. These infections may be persistent or episodic. Many cases will have bouts of illness interspaced with periods of apparent normality. Eventually, however, the immune system will fail and persistent and worsening illness will take over. With active FIV, cats will show a fever, lymphadenopathy, and leukopenia. This is normally followed by an asymptomatic phase. The second or chronic phase are as a result of the failing immune system and includes anorexia, weight loss, pyrexia, and lymphadenopathy. Gingivitis is a common clinical sign, as this is an entry point for bacteria. The gingivitis can be very severe and chronic, And sometimes the only treatment is to remove all of the teeth, which is the source of infection, as can be seen in this photo, with the before picture on the left and an after picture with teeth removed on the right. With diagnosis, clinical pathology will reflect the destruction of the immune system. As mentioned, there may be an asymptomatic phase of FIV where the virus itself is difficult to detect. Diagnostic assays therefore rely on the detection of antibodies to FIV. SNAP tests are available that can be used in the clinic, and they are sensitive and specific. However, you need to be aware of the fact that maternal antibodies and antibodies as a result of vaccination can affect the results. And this should always be remembered when interpreting results. The treatment of FIV will be covered in small animal medicine, and it's only included here for completeness sake. Management of FIV positive cats is to try separate them from FIV negative cats, neuter the cats to reduce the amount of fighting and aggression, and prevent opportunistic infections. So good nutrition, control of parasites, and good husbandry is key. There is no need to euthanize an FIV positive cats, as many positive cats can lead long, healthy lives with the proper care and treatment. An inactivated vaccine is available overseas, but this is not available in South Africa. Please remember that vaccination can interfere with the interpretation of diagnostic tests. So on to feline leukemia virus. This is also a retrovirus. This can result in 3 different syndromes in cats. The first is degeneration of the immune system and lymphopoietic system, resulting in immunosuppression. Second, you can get malignancy due to uncontrolled proliferation of the lymphoid system. And third, you can get degeneration of the myeloid system, resulting in non-regenerative anemias, thrombocytopenias, lymphopenias, etc. The epidemiology of feline leukemia virus is similar to FIV, but there are a few differences which I will highlight. It differs from FIV in that it is more contagious than FIV, as it is spread through close contact, mainly through saliva, and vertical transmission occurs more readily than has been reported for FIV, where it has not been shown conclusively. Successful transmission of feline leukemia virus occurs with repeated contact with high concentrations of virus at an early age. It is a slow developing disease as clinical signs appear months or years after the exposure. An immunocompetent cat is able to clear the infection. Cats that are not able to clear the infection either go on to develop tumors, either systemic or restricted to certain organs, or there's destruction of either lymphopoietic or myeloid tissue, resulting in immune dysfunction or anemia, respectively. So this pathogenesis can be viewed in graphical form in these figures. Myeloid suppression will present as anemia and other platelet and lymphocyte abnormalities. Immunosuppression will present as recurrent infection, normally of the upper respiratory tract, and stomatitis and gingivitis. Progressive infections will be evident as lymphoma or leukemia or tumors in various organs. There may be excessive undifferentiated lymphoblasts in the circulation, with many mitotic figures, which we can see in the left, or tumors in various organs, as can be seen in the figures on the right. So we can see tumors in kidney, spleen, and in the liver and spinal cord. Cats that do not mount an effective immune response develop a persistent viremia, and the virus is shed in saliva, tears, urine, and feces. The diagnosis of feline leukemia virus infection is therefore based on the detection of viral antigens in the serum. Compare this to detection assays for FIV. The management of feline leukemia virus positive cats is the same for FIV. What does differ is that there is a vaccine for feline leukemia virus in South Africa. So that covers the cats retroviruses onto bovine leukemia virus. There are three main syndromes associated with bovine leukemia virus. In the majority of cases, the infection is subclinical. Up to 30% of infections result in a persistent B-cell lymphocytosis, and then up to 10% of infections will result in the development of solid lymphoid tumors. So bovine leukemia virus infection needs to be differentiated from sporadic bovine leukosis, which is a condition that occurs in young calves and is non-contagious. There are three forms of sporadic bovine leukosis, namely a juvenile, thymic, and skin form. So like other retroviruses, bovine leukemia virus occurs worldwide and does not survive for very long in the environment. The penetration of skin is required for transmission, so bodily fluids are not an important source of infection. Rather, the most important method of transmission is iatrogenic, that is, caused by humans. Examples include the use of dirty needles, ear tagging, or using dirty dehorning or castration equipment. Transmission of the virus through the use of contaminated blood vaccines can also occur, as well as through the mechanical transmission by biting insects such as Demoxys. After infection, there is no viremia, but the virus stimulates a strong humoral response. There are various methods to diagnose the disease. Control is dependent on test and slaughter and the use of clean equipment, and there is no vaccine available. Retroviruses of sheep. The first is Jaarziekte sheep retrovirus. This virus was first described in South Africa and causes slow-growing pulmonary tumors in sheep. The disease is therefore only seen in older sheep. These sheep will lag behind in the flock. They may be dyspneic, and there may be fluid dripping from the nostrils. Transmission occurs through aerosols containing infected droplets. The virus infects Clara cells that are secretory epithelial cells. There is therefore an overproduction of fluid in the lung, causing lung edema and muffled lung sounds. A wheelbarrow test can be performed. What this test is it involves lifting up the sheep by its back legs, and then with severe cases, large amounts of lung fluid will pour out from the nostrils. Okay, so just to recap, we have discussed retroviruses of cats, namely feline immunodeficiency virus, feline leukemia virus. In bovines, bovine leukemia virus, and in sheep, Jagdziekte, sheep retrovirus. So another retrovirus affecting sheep is Visni medi. So Visna means shrinkage or wastage in Icelandic, where the disease was first described. The wastage is as a result of a paralyzing meningoencephalitis. The other syndrome that can occur is MADI, which refers to labored breathing. This disease does not occur in South Africa. A similar condition occurs in goats, but this disease is caused by caprine arthritic encephalitis virus. Equine infectious anemia virus is a retrovirus affecting horses and is not thought to occur in South Africa.